Okay, so I've started to share the presentation. Are you able to see the slides?
Yeah.
No,
Yeah.
Yeah.
I can now. I can now.
Perfect. Okay, so hello everyone. Good evening, everyone. Thank you very much for inviting me today. So my name is Hector. I'm one of the neurologists working in the Ataxia Centre in London, in Queen Square. And today, so basically, Tim asked me to give you a little talk today, and we were trying to discuss a little bit what to talk about, and he suggested to talk a little bit about curative treatments and other treatments for ataxia. As you know, for most of the forms of ataxia, we don't have a curative treatment, so we don't have a treatment to help you to get rid of the ataxia. Okay. But I think that, I mean, that's a very common situation with neurological conditions. For most of the conditions we see as neurologists, we don't have curative treatments. But I think it's very important for other professionals, for other doctors, and also for patients to understand that despite the fact we don't have curative treatments, we have a lot of symptomatic treatments that we can use to treat some of the symptoms of the ataxia. And I think that's very important because we need to spread the idea that we have a lot to do with patients with ataxia. It's not like, as we don't have a cure for the ataxia, we can't do anything. So we have a lot of things to do. So today, I would like to talk a little bit about treatments for some of the symptoms of ataxia, and then I'll tell you a little bit about how is the COVID situation now in terms of how the clinic is working, and then I will answer some of the questions that Tim fed me before. By the way, this title of the presentation, Everything You Have Always Wanted to Know About Ataxia in London, was Tim's idea. I thought this was a very nice title for the presentation, but it was his idea. I want to acknowledge his contribution. So the first thing I would like to tell you that so there are several documents out there that we can use as guidelines to treat the symptoms of ataxia. I'm sure one on the left, which is the guidelines for the management of ataxia that Ataxia UK published, and I always recommend the patients to take this document with them to their GPs, for instance, because I think it's a very good guideline and it's very helpful for other professionals. And there you can find all the treatments that we can use to treat some symptoms. The ones that Ataxia UK produce are general for every type of ataxia. And the ones on the right that were developed by several associations, including FARA, are more focused on Friedreich's ataxia, which is the most common type of ataxia, which is inherited. So if after this presentation you are more curious or want to know more, I recommend you to have a look to these documents. So as you know, so probably when you go to other clinics, the GP or general neurologist, when you say that you have ataxia or a form of cerebral ataxia, probably you are asked about all these symptoms. How is your gait? How's your walking? Can you run? Can you go up and down the stairs? Do you have falls? Do you have problems with your hands in terms of your hand dexterity, doing fine movement with your hands? How is your speech? Do you have a slurred speech? Because probably these are like the most well-known or the most evident, the most overt signs of ataxia, right? But the problem is that ataxia is, or in patients with ataxia, this is not the whole story. There are many more symptoms that sometimes we don't ask directly, and sometimes the patients don't tell us, because sometimes you don't associate, I don't know, a problem with your bladder to the problem with the balance, because it's not very intuitive, right? So some of the symptoms that can be a little bit overlooked are, for instance, problems with the eyes. Some patients with ataxia, they have double vision. You have problems with focusing. When you want to look at a particular target, it takes a little bit of time. The hearing, some patients and some forms of ataxia, you can develop problems with the hearing. As I said, bladder problems, they are very frequent. Having urgency, increased frequency, you need to go several times more than usual to the toilet. Also problems with bowel, like constipation, which is quite common. Also pins and needles, pain. Sometimes we don't really associate pain to the problem with the balance, but in patients with ataxia, you know that pain is a common symptom and quite disturbing, and which has a real impact on your quality of life. Also, for instance, the stiffness, I will talk a little bit more about that, sometimes especially in the legs, and it can be very disturbing. It can impact on your gait, but also can be linked to pain. And also more and more we are seeing problems in cognition and mood. I will expand a little bit more about this. So today I would like to talk a little bit about all these symptoms that probably they are not as known in ataxia, and to also I would like to convey you the idea that we have treatments for these symptoms. So it's very important that when you go to your doctors, to your neurologists, that you talk about these things if they don't ask directly. I tend to be very pedantic in clinic, and I ask about almost everything when I see patients, but obviously sometimes we don't have as much time, or the doctor doesn't have such a broad experience in ataxia. So you also need to know that this could be related to ataxia, and you need to tell your doctors. So for instance, starting with the spasticity, when doctors, when neurologists talk about spasticity, we are referring to an increased tone. So basically your legs and your arms have tone, they are not floppy. So for instance, think about when someone passes out, they are completely floppy, they don't have any tone. But this is not the situation that we have when we are awake. We have tone, we are not floppy, we are not like these rubber toys, right? But one of the common problems in ataxia is that that tone is slightly increased. So your muscles can be stiff. And one of the things that are linked to this spasticity, to this stiffness, are the spasm or cramps. I'm sure some of you have had cramps in the past. They are painful contractions of the muscle, so the muscle gets very stiff and pulls, and it could be very painful, and some patients can have the spasm for hours even. Sometimes in patients with advanced forms of ataxia, this increased tone can produce deformities. So for instance, as I said, the stiffness is very common in the legs, and sometimes it affects the feet. So sometimes the feet can get abnormal postures, and in the long term, it can make it difficult for the patient to even stand up because your feet are like twisted. And something that also is related to this is like, because of this change in the posture, for instance, of the feet, the Achilles tendon gets shorter. And if we don't put a treatment for that in the long term, that cannot be placed back in the normal position, and you might need surgery. So spasticity, the stiffness, is a very important symptom that to be honest, we don't normally ask in a regular clinic or in a quick clinic, but it's something very important. So normally we have several treatments for the spasticity, for the cramps, but it's very important to, I mean, not only for the spasticity, for all the treatments, I think it's very important to discuss with the patients, the aims of the treatment. because something that I've seen in general is that sometimes there's not a good communication between doctors and patients, and the patient doesn't really understand why we are prescribing a treatment or which is our aim with the treatment. So, for instance, when we try to treat the spasticity, we have to discuss with the patient which goals we aim to achieve. So, for instance, it could be a matter only of trying to reduce the spasm or the cramps, which are very painful. Or, for instance, our aim is try to prevent these deformities that I was telling you that can happen in the feet, just to help the patient to be able to stand up with help. Okay. In general, the spasticity can be linked to weakness, to loss of power. But when we treat the spasticity, we normally don't aim to treat the weakness because we can't treat the weakness. So this is very important because some patients think that the treatment is to help with the weakness, and it's more to help with the increased tone, with the stiffness. And as I put here, we can use both non-pharmacological, that is to say, physiotherapy, or pharmacological drugs for it. So, for instance, physiotherapy for cramps, for spasm, for increased tone, for the stiffness, is very important to do the stretching exercises that could be passive or active. Passive means that someone else helps you with that, and active is that you do it by yourself. So, for instance, it's very common to have cramps in the calf. So we recommend the patients to do stretching exercises. For instance, if you have a rubber band, this kind of rubber band that people use for gymnastics, you put the rubber band around your feet and you pull a little bit to stretch the calf. Okay. And if you can do it by standing, what you can do is that you can go against the wall with your foot placed behind you, and you try to extend the calf. Okay. If you want to know more, we have in the Ataxia clinic some leaflets with stretching exercises. And this is very important because some patients with cramps, just by doing this on a regular way, which means every day at least 5 to 10 minutes before going to bed, they have the cramps quite controlled, because normally the cramps tend to appear at night, and obviously it disrupts your sleep. Then, for instance, it's very important to avoid infection, diarrhea, constipation, because all those things can make the cramps worse. And then if we can't control the cramps with this physiotherapy and exercises, we have tablets that we can use to control the cramps. Mm-hmm. So, for instance, maybe some of you are having or are taking, or you have taken in the past, baclofen, tizanidine, gabapentin. All this medication, we tend to use it for the cramps. Most of them, they are muscle relaxants. So that's the idea, that we relax the muscle a little bit. Another thing that I would recommend you, because you also need to do your homework as patients. So it's very important that you as patients, you know which symptoms you have and what's the reason for the medication you are taking. And if you don't know, you have to ask your doctors. You have to ask them, explain to me what is this which is happening to me. How do you call it? Which medication are you prescribing? Why am I taking this medication? Okay, because it's very important that you know the reason why the medication is prescribed. Because the problem is that some of these drugs, we can use it for different things. So obviously, it's very important that you know, okay, I'm taking the gabapentin because of the cramps. It's not because I have other symptoms, okay? Because then we normally ask you these kind of things in clinic. So it's very important that you know the symptoms you have and the medication, and each medication, the reason why it's prescribed. Another symptom that sometimes patients refer, tremor, which means to be shaky, to have some shakiness. In general, the tremor is a very annoying symptom because the response to medication is not very good in the case of ataxia. In other patients with other conditions like Parkinson's disease, the tremor can respond to the medication, but in the case of ataxia, it's more difficult. And the most important thing is that we only treat the tremor when it's bothering you, in your daily life. So this means that if you have a little bit of tremor and it doesn't bother you, it doesn't make things harder for you in your daily life, don't worry about it, okay? But if you have a tremor that is bothering you or makes things more difficult or tricky for you, we can try to address it in clinic. For the tremor, the best thing that we can do is try to do some physical therapy and especially occupational therapy, because they can teach you some strategies to try to minimize the impact of the tremor. So for instance, they tend to recommend when you do things to stick your arms to your trunk to have more support, or for instance, if you are going to write or doing something with your hands, to let the arm be on top of the table or on a chair to have some kind of support, because that helps to reduce the tremor. So for instance, if you are struggling with tremor when you use a spoon or a fork, there are some kind of special cutlery which are a little bit heavier, and that helps with tremor a little bit. So these are all these strategies that we can try to implement. Sometimes it's a matter of trial and error. Sometimes we have to try different things to find what really suits you. And then we also have medication for the tremor. As I said, normally the tremor in ataxia is not very doesn't respond very well, but nonetheless we can try to some medication if you have a very bothersome tremor. Another symptom, this is a little bit uncommon and it's difficult for you to know if you have dystonia or not. But normally what we define this dystonia, we call it when there's contraction of agonist and antagonist muscles. So basically this means, so for instance, if you want to bend your arm, the agonist muscle, yeah? Oh. So if you want to bend your arm, the agonist muscle is the biceps and the antagonist is the triceps. So one muscle does the movement and the other one has to relax. So in dystonia, this doesn't work and both of the muscles are contracted. So basically in dystonia, what we see is that you can have some deformities. In the general population, for instance, it's very common the dystonia of the neck, and you can see some people, for instance, sometimes they appear on TV that they have like a twist neck. So normally dystonia is when there's some twisting of some parts of the body. And the problem with dystonia is that it can be painful, but as I said, we have treatments for dystonia. So if when you go to the neurologist, they say, oh, you have a dystonia and we have to treat the dystonia, probably they will recommend you physiotherapy, and also we can use botulinum toxin. So you know the toxin that people sometimes use in the face to get rid of the wrinkles and to look younger. So that toxin is a muscle relaxant, and we can use it to treat dystonia, okay? So if when you go to clinic, you are told you have dystonia just means that your muscles are not contracting and relaxing in the correct way, and it can cause some twisting of your body parts, the neck, or maybe a hand or something like that. And if the dystonia is bothering you, they can treat it with botulinum toxin, okay? In some patients with ataxia, if they have dystonia in the whole body, we can't be putting the botulinum toxin everywhere. So we have to give the patients tablets, okay? But this is not as common in ataxia. Most is more common in other kind of conditions. Then we have pain. Pain is a very, very important symptom in general in neurological conditions, and especially in ataxia. The pain is very varied. It can appear because of different reasons. It doesn't have only one single cause. So for instance, you can have pain in ataxia of a musculoskeletal origin, because of, as I said, if you have a twisted foot, or because, for instance, if you don't have a good back support and you spend the whole day sitting down on a chair, for instance, so that can cause pain. But there's also another type of pain which we call neuropathic. Neuropathic basically means that it's because the nerves are not working properly. So in some forms of ataxia, we see that the nerves, the nerves which are capturing the touch of your hands, or of your feet, they are not working properly. And because of that, you could have pain. Normally, the neuropathic pain is a pain that it's sometimes you can feel it like a burning sensation, like or even when you touch the skin, even if you do it very softly, it feels like annoying or even a little bit painful. And it tends to appear at night. Some patients tell us, when I try to get in bed and the bed sheets touch the skin of my feet, I have this horrible feeling, this burning sensation, and so on. This is what we call neuropathic pain. It's very important that you understand that we can treat this neuropathic pain, but if you only have pins and needles, the medication is not helpful with that. Okay, so if you only have pins and needles, but they are not painful, the medication doesn't work very well. You need to have proper pain, okay? And for instance, depending, this is the reason why it's very important when you say that you have pain, that we ask you about the pain and try to characterize, try to define which type of pain you have, because depending on the pain, we should do certain things or not. So for instance, if you have musculoskeletal pain, the pain due to the muscles or the bones because of the bad posture and so on, the best treatment is to have physiotherapy. If you have, for instance, neuropathic pain, we have tablets for this. So for instance, amitriptyline, gabapentin, duloxetine. So as you see, because if you remember, we also used gabapentin for the spasm or the cramps. So this is an example of one drug that we can use for different things. If you have a case of very severe, or we can't control the pain with the tablets that we normally use in clinics, we can refer you to the pain management clinic, okay? Because probably you need a combination of different treatments. Then the bladder. The symptoms with the bladder are extremely common in patients with ataxia. And I have the feeling that they are the group of symptoms that we tend to miss the most, because probably we don't associate problems with the balance with the bladder issues. And also because I understand that sometimes it's very difficult for the patients to report these symptoms, because maybe you feel ashamed, or you don't link the two things, or maybe just because you have got used to having these symptoms and you think that is something normal. So for instance, so this is why we need to ask the patients directly about that. So don't get offended if you come to the clinics and we start to ask you about the bladder. Sometimes patients ask me, why are you asking me all these questions? No, this is the reason, because sometimes there are symptoms associated to the bladder function. Normally, the most common situation is that you need to go very frequently to the toilet, both during the day and at night. That is what we call increased frequency. And also that you need to rush. So you can be at home and suddenly you start to feel the desire to go to the toilet and you can't hold your urine. You really, really need to go. That is what we call urgency. And in very severe cases, you can have incontinence. The urgency is so severe that you don't have enough time to reach the toilet and you have an accident. And obviously this is very invalidating because, I mean, it limits your quality of life when you go outside and you are having a walk or in a place that you don't know if there's a toilet around or not. Sometimes we can also see the other spectrum, the other way of the things, and we can have problems. You can have problems with voiding, so it's not easy to empty your bladder. And the problem with problems where you can empty your bladder completely is that if there's a little bit of urine in the bladder after you have passed urine, that can make you more prone to have urinary infections. Okay, so this is something that we need to know to prevent urinary infections or to think of urinary infections if you have fever. Normally, when someone in the clinics tells us that they have problems with the bladder, we send them to our uroneurologist team. The uroneurologists are the neurologists who see patients that have problems with the bladder. Basically, they probably some of you have had this test, but they do what is called a urodynamic study. So they ask you to pass urine while they are measuring different things. Because as we said, we need to know if there's still some urine in the bladder after you pass water, and also to see how your bladder is working. Okay, and also it's very important to rule out other reasons, because for instance, in men over the age of 50, you know that that we can develop problems with the prostate, and the prostate can also create problems with the bladder. So sometimes it's a little bit difficult to know if it's related to the ataxia or there could be more things affecting the bladder. As I said, there are things that we can do for the symptoms for the bladder. So for instance, if any of you have this has these problems with the bladder, it would be good to avoid as much as possible coffee, tea, fizzy drinks, alcohol, because we know that all these substances, they tend to worsen these symptoms. So sometimes if your symptoms are mild, just by doing these kind of things, you can improve your symptoms. Then sometimes we ask the patients, okay, to try to avoid this urgency, try to go to the toilet to pass urine, I don't know, every 3-4 hours. And you have like a schedule to avoid to reach to that point where you need to rush or to avoid the point of having an accident. Also, it's very important that even though you have these problems with the bladder, that you try to drink enough water. Because something that we see sometimes is that patients, as they feel that they have these bothersome problems with the bladder, what they do is that they reduce the amount of water, because you learn that if you don't drink, you don't need to go to the toilet. And the problem is that we sometimes see patients that they are drinking no water at all or very small amounts. You have to make sure that at least your daily intake of water is between 1 or 2 liters at least, okay? And as I said, if you are very bothered by the symptoms with the bladder, we have medication that we can prescribe in clinic. And sometimes there's something that they have been doing for some years, which has this strange name called transcutaneous posterior tibial nerve stimulation. And basically what they do is that they put an electrode in one of the nerves in the leg, and they give you like a small electric shocks. And by repeating these for several sessions, it helps a little bit with the symptoms of the bladder. So basically this is a picture that I found on the internet. So basically they put here the electrode, and they give like electric stimuli. We don't understand very well how this works, but it seems that works. Okay, and in some patients, it really helps them with the symptoms with the bladder. Okay, as I said, sometimes it's a matter of trying different things and see what best fits you. Then also problems with the bowels. As I was saying, the most common is the constipation. And again, the constipation can be related to the ataxia, but it's probably more a consequence of the ataxia. You know that because of the ataxia, you tend to move less, you tend to spend more time either sitting down or lying down, and that contributes to the constipation. On top of that, if you have problems with your bladder, you will be drinking less water, and with less liquid intake, you tend to develop more constipation. Okay, if you suffer from constipation, it's very important that you tell us, because there are things that we can do. We can advise you with some diet, increase the amount of fluid, and so on. And if we are dealing with a complicated or a severe case, we can refer you to our colleagues in the neurogastroenterology clinic. Okay. Then, as you know, sometimes problems with swallowing, what we call dysphagia. Dysphagia means problems with swallowing. So this is also a very common problem in ataxia, because as you know, the coordination of the muscles of the face and the throat is not working well. So it affects your speech and also your swallowing. And it's very important that if we don't ask you, that you tell us if you choke on liquids, if you choke on food, because some patients don't report that. What you try to do to avoid this is to reduce the food you are eating, or you are eating certain type of food that you find it easier to swallow. And it's also very important that we know if you have problems with the swallowing, because in the long term, they can increase the risk of having pneumonia, because either the saliva or the liquid or the food can go to the lungs. And it's something that we could also do some interventions. We can refer you to the speech and language therapist. Or for instance, if we see that you have been losing weight because the problems with the swallowing, we can refer you to the dietitian so that you are provided with supplements. Okay. And then for another of the problems that I was mentioning, the hearing. It's very common in patients with ataxia, with certain types of ataxia, that they develop problems with the hearing. And it's a type of problem that is not like the problems you develop with age, where you can't hear things properly. In the typical problems with the hearing that appears in ataxia is that you can't understand well what people are saying, especially in a busy environment. So if you are in the pub, or if you are at home with the TV on and you try to talk over the phone, it's very difficult to understand what people are saying. You can hear them, but it's difficult to understand.
Got it.
And if you have these problems with the hearing, it's very important that you tell us, because we need to refer you to an audiological auditory or audiological assessment. In general, for the problems with the hearing, the hearing aids don't work too well, because
voices are totally playing sounds.
Yeah.
Because as I said, the problem is not that you don't hear things, it's that you don't understand. So normally the hearing aids, what they do is that they amplify all the noises, and sometimes it makes you even more difficult to understand.
Hector, can I interrupt you for a minute?
Yes, sure.
Barbara, your microphone is not muted.
Actually, I give her a lot of.
Barbara, can you hear me? Your microphone is not muted, and it's probably at the bottom left of your Zoom screen. If you could mute your microphone, there's a picture of a microphone, and if you just click on it, it should mute it.
Microphone.
At the bottom of your Zoom screen, bottom left-hand corner, possibly.
The bottom left-hand corner, I can't see it.
Well, because otherwise we can hear you talking. So you either need to stop talking or mute the microphone. Otherwise we hear you and Hector. Okay, so shall I? I'll be quiet and I'll let you continue, Hector, and hopefully we won't get any more noises.
No problem. So as I was saying, normally the hearing aids don't work too well, don't help too much because they amplify everything. And the problem patients normally have is that they can hear the sounds, but they can't understand what people are saying. But my colleagues in the audiology department, in the last year, they have been using these devices called FM devices, where you have kind of headphones or some kind of hearing aids, and then you have like a kind of a microphone. And sometimes you can put the microphone next to the source of the sound you want to hear, and it amplifies, let's say, selectively only what you want to hear. The main issue is that apparently these devices they cost a bomb, and I think that's the main issue now to the implementation of these devices. But nevertheless, if you have problems with the hearing, we'll try to explore this avenue for sure. And then also it's very important to have the input of a hearing therapist, because sometimes they can teach you strategies, or maybe if you have a very severe hearing impairment, they can help you to lip read. So, and obviously the speech and language therapies also to deal with problems with the communication and so on. Then, as I say, also the eyes. There are problems with the eyes in ataxia. We know that the most common thing is that you have problems with focusing, that it takes you a little while until you can see a target clearly. And sometimes you have this feeling that things are like shaking a little bit. And normally this is due to the nystagmus. Nystagmus is this kind of shaking movement of the eyes sometimes that we see in patients with ataxia. The nystagmus, sometimes we prescribe gabapentin for that, but it's another symptom in ataxia that doesn't respond very well to the medication. The double vision is not, I mean, having double vision all the time is not frequent in ataxia. Sometimes you can have double vision when you look to one side, to the other, or sometimes when you are tired, but double vision all the time is not as common. But if you have double vision all the time, we have treatment for that. We can send you to our colleagues in neuro-ophthalmology, and they can put prism in your glass. So it can help you in your glasses. So it can help you to have to get rid of the double vision. And if you have double vision, it's very important also to know it, because you need to tell the DVLA, and probably you won't be able to drive if you have double vision all the time. Then cognition, I think you were particularly interested in cognition, and in your groups you have been discussing a little bit. So basically, first of all, cognition is a very complex, a very sophisticated brain function, because cognition, it's everything that makes us humans. Cognition refers to our attention, to our memory, the ability to recognize where we are, the ability of use tools or different objects. So cognition is a very, very complex cerebral function. And cognitive problems are very, very frequent in neurological conditions, and especially in ataxia. In general, the most common type of cognitive problems in ataxia is problems with attention and problems with planning actions and what we call multitasking, to do different things at the same time. It's not as common in ataxia to have proper problems with the memory. Like, for instance, you could find in patients with Alzheimer's disease. For instance, Alzheimer is a type of dementia, and the memory is quite impaired in Alzheimer's. In ataxia, it's more the attention. And sometimes if you have problems with attention, you can feel that you also have problems with the memory. But it's not a primary problem with the memory. Is that as you don't have a good level of attention, you cannot acquire new information. So for instance, you can think of a situation where you are very tired or very sleepy. In those situations, your level of attention is going to be low. So you won't incorporate new information. If you are very sleepy or very tired and someone starts to talk to you about something new or something they want you to remember, probably you won't be able to remember that. But it's not because you have problems with the memory, it's because your attention is low and you don't acquire, you don't incorporate that new information. If you have problems with attention, they can also be impacted by other things, like for instance, fatigue. If you have fatigue, if you have tiredness, probably you will feel that you are more forgetful, that your attention is not very good. Also, if, for instance, if you have low mood, if you are feeling blue, that could also make you feel less attentive to things that are happening around you. Or for instance, if you have a hearing problem and you don't pick up very well what other people are saying, probably you don't acquire all the information. So probably then you don't understand how things are, what is happening, and probably you won't remember some information. If you tell us that you have this kind of problems, the first thing that we normally do is do a neuropsychological test, which is like a 2-hour exam where they do a lot of different things, a lot of different exercises with you and a lot of different games to try to see which part of the cognition is failing. Unfortunately, we don't have treatments for the condition per se. And what we do is to try to treat all the things that could be impacting. So for instance, if you think that that you have problems with fatigue and that it's making you to have a worse cognition, we would tend to treat the fatigue. Okay, but there are no problems, there are no treatments in particular for the cognition, and it's a very common symptom. And also the mood. We know that problems with the mood are very frequent in neurological conditions, and in particular in ataxia, especially in the form of low mood and anxiety. And this can be due to different reasons. So we know that you can have low mood or anxiety because of the ataxia. We have seen that, for instance, in other conditions like multiple sclerosis, Parkinson's disease, patients develop depression, for instance. So it could be because of the ataxia, but also it could be because of the reaction you have to the impairments of the condition. Obviously, if you are not able to do something anymore that you were able to do in the past, obviously you have low mood because of that. Is the normal way a person would react to that. And obviously, and especially in these times of COVID, the social isolation is another reason to have low mood, because obviously we are social animals. We tend to socialize, to have relationship with other people in our environment. And obviously, if you have been locked in your house for months without seeing anyone apart from the computer screen, this is something that also has a toll in your mood. If you have problems with the mood, we can help you. We can refer you to the neuropsychiatrist or any other psychiatrist in your area, and we can try to explore different interventions like counseling, the very famous cognitive behavioral therapy, the CBT, and for instance, the patient support groups are really helpful also with the mood. Something that I would ask you is that if you feel that you have problems with the mood, I know it's very difficult because obviously you are feeling depressed, or if you are feeling down, you don't want to engage in things, and you don't have stamina, you don't have energy. But if you have problems with the mood, try to be open to try different things. Sometimes when I suggest, I don't know, going for CBT to patients, they say, well, you know, I'm not very convinced about this. They didn't help me in the past. I don't want to try it. And I think we should try to change that, because, okay, if the first time it didn't work, let's try again, because maybe the person who was giving the therapy has changed, and maybe you have a better relationship with the new one, for instance. And it's very important also that if you go to these kind of therapies, the counseling, the CBT therapy, that you engage with the therapy. It's very important that you make your best effort for this. Unfortunately, in general, the mental health care system is very variable among the different regions of the country. And I have some patients that they say that they are very happy and they receive a very good care. And in other areas, patients are really unhappy and there are no resources. So it's true that this is a little bit tricky depending on where you live. But the most important thing is that if you feel that you have problems with the mood, let us know. Go to your GP, because there are things that we can do. And I think these are all the symptoms that I wanted to talk to you today. I have a couple of slides with a little bit of how we have been dealing with COVID and some of your other questions. So I don't know if Tim, you want to have the break now, or should I finish and then we continue?
I just know that when we've had our meetings before, we've often had a break after 45 minutes because people feel rather stiff, and maybe, okay, you've been talking about cognition and attention, and maybe people's attention is wavering. So should we take say a 10-minute break? Is that okay with you?
Yeah.
And if we start again, so it's what says 6:54. So if we'll start precisely at 4 minutes past 7. Okay.
Enough.
Great. So enjoy your break. Make yourself a cup of well, no, probably caffeine may not be a good idea. So make yourself a drink, have a glass of water,
or have decaf tea.
Yeah, or a decaf. Yeah, a decaf tea. Great, good idea.
Off I go then.
See you in a bit.
And just to remind you all that you're on mute. You're all on mute.